Can clients choose the sex of the baby if they went through IVF?
Yes, that's a very interesting question. Yes, it's possible for them to choose, but that will mean before the embryos are put in the woman's womb, we have to do genetic testing because the embryos look the same. They have no breasts. They are not yet, you can only know it by the genes.
Yes, sure.
Yes, so you do genetic testing to know, so they can choose.
Thank you so much. Hello, Bethan TV. Thank you for the show. My name is Joel. Please, doctor, talk about the oils and creams of penis enlargement. How effective are they? And do you recommend them? I think this should be a topic of its own. Of its own. Yes.
One of the things which is clear is we do not have effective support for male sexual challenges. It's ignored. We neglect it, and many men are struggling. They are doing so many things, either increase their power or the size of the penis and all these things. So it's a big challenge. We have to pay attention to it in our population. Yeah.
It's from Nigeria.
So
she has failed to conceive for, she said 10 years?
Oh, no, 1 year. She
1 year?
changed. Yeah.
Okay.
And she has painful periods.
Yes, painful periods.
Yeah, so failure to conceive for 1 complete year is a concern, and it's one of those definitions we use for infertility. So once that happens, we need to find out the cause in her. She has painful periods. Maybe possible that she could have issues with the tubes because some of the conditions which give painful periods also have effects on the tubes.
Okay.
But she needs an evaluation to check her tubes, her womb, and her hormones.
Okay.
Yes.
Thank you.
And it could also be a problem in a man. We should not forget.
Yes. Sometimes we need to work as a couple.
Exactly. All the time we encourage people to do full evaluation. Yeah.
Yes, been with the wife for 1 year. She has failed to conceive. What could it be?
Yeah, so again, we thank him for that concern. It's good he's getting concerned before it's long.
Yes.
Yeah, so definitely they need to be evaluated. Now, the problem could be in him as well. The problem could be in the woman. But they need to be, yes, or both. So they need an evaluation. Yes. The woman's tubes, they need to check her womb, they need to check her hormone profile, and also they need to check his sperms.
Thank you so much.
So those must be checked.
So you need to go to the hospital at least and seek a proper medical guide. He's talking about the cost.
It's costly.
Yes, and he wants to hear from you whether other arrangements that can enable someone to acquire the process. Yes. I think when you look at 19, it can look really huge. Yeah,
so of course, the truth is it's a costly thing at the moment. It's unfortunate he didn't pick up our promotional season. Yeah, for about 3 months up to the end of December, we had a promotion. We reduced the cost of IVF. I think people were getting IVF done at cost of 12 million as well. Yeah, so the thing is IVF, the ingredients are expensive. So we had to talk with some of our suppliers because we've been working with them for some time and we share the pain of our patients. It's painful to have people miss this treatment because they cannot afford. But just let him get encouraged. We are working around the clock. We are humans and we feel for our people. So we all the time we try to find ways. If we get some people to sponsor, that's well and good. And also in the near future, we think it will be very important for us to increase our innovation so that some of these things which are bought can be formulated from here like the media and so on. We are working on that.
Thank you.
It's still at early stages, but we will soon probably start doing some of those things.
Thank you so much, Doctor. We still have a lot of calls coming in and questions, but we are now time bad. Our time is used up. Well, let's go to our last segment quickly. Myths about this. Number 1, sperm donation is only collected through masturbation. True or false?
False.
Very good. Candidates only donate for a paycheck. Truth or false?
False.
Donated sperms only goes to infertile heterosexual couples. True or false?
In our environment,
Yeah.
yes.
Thank you. Blood group difference can affect the recipient's chances with compatibility. True or false?
False.
Very good. The more you donate, the more you grow old. Truth or false?
False.
So much, Doctor. Please say your last words to the viewer, and then we close the show.
Oh yes. So I want to encourage the viewers that these services are available, but especially people who can be able to donate and they are fit to donate. I want to encourage them. But my special appeal is to the women who haven't yet decided when to start having their children. It's a very good practice to keep your eggs. They have to store the eggs. Yes.
Thank you so much, Doctor. That has brought us to the end of our class discussion between Teacher Zita and Dr. Anabat. We shall bring another interesting stories, another interesting topic, because it's here, only here, where you have free consultation. You learn a lot as far as your health is concerned. Please sleep well. Thank you.